Hello, my name is Tatiana Komarova. I am a consultant physiologist at Neurosoft. In this video, we will demonstrate the technique of placement of electrodes and sensors required for conducting a polysomnographic study. The delivery set includes all the electrodes and sensors required for diagnosing sleep disorders in accordance with recommendations of American Academy of Sleep Medicine. The delivery set has the electrodes that are necessary to record an electroencephalogram, electrooculogram, electromyogram, and electrocardiogram. To record these parameters, we can also use disposable electrodes with a button connector and a corresponding cable. An airflow thermistor sensor is used to record the respiratory flow. This sensor is designed for both adult patients and children. Additionally, a nasal cannula can be attached to the patient and connected to a differential pressure sensor to record the respiratory flow. This sensor is built into the neuron spectrum AM. To measure respiratory effort during polysomnography, we use a respiratory effort sensor with a belt of different lengths, or RIP belts, with corresponding sensors. A single-use pulse oximeter sensor and a reusable pulse oximeter sensor in two sizes for adult patients and children are used to record the saturation of hemoglobin in arterial blood with oxygen. In addition, a snoring sensor and a body position sensor are included in the delivery set. The Neuron Spectrum AM features the built-in body position sensor. Today, we will use the portable Neuron Spectrum AM polysomnograph, which we previously fixed on the patient using a special belt. This PSG device transmits data to the computer via Wi-Fi. According to AASM recommendations for recording and analyzing the stages of sleep, it is crucial to record an electroencephalogram, electrooculogram, and electromyogram. It is recommended to record the following EEG derivations during electroencephalogram registration. These derivations are F4-M1, F3-M2, C4-M1, C3-M2, O2-M1, O1-M2, where M1 and M2 are reference electrodes that are positioned on the mastoids. Points F3, F4, C3, C4, O1, O2 are active electrodes located on the patient's head in accordance with the 1020 system. The NeuronSpectrum.net software has a special tool that helps you quickly identify these points. To use it, you need to take several measurements and enter the data into the software. We need to measure the following distances. The first distance from the nose bridge to the occipital region is the Nash-Inian distance. Half of this distance is point CZ. The second measurement we need is the distance between external auditory metases. Moreover, we must measure this distance through point CZ. The third distance is the patient's head circumference, and the circumference lines must pass through the points FPZ, OZ, T3, T4. After we enter these distances into the software, it will calculate the distance between the main active points on the patient's head. To attach the EEG electrodes, we will need an electrode adhesive paste. We can use either uni-paste or 1020 paste. Additionally, we can pre-treat the skin under the electrode with an abrasive paste, which will significantly reduce the impedance. It is recommended to start placing electrodes by attaching the ground and reference electrodes. The ground electrode may be placed on the patient's forehead just below the hairline or at the point FZ. Preliminarily, the skin under the electrode should be rubbed gently with an alcohol wipe and, if it is necessary, with an abrasive paste. Fill the electrode cup with electrode paste. It is enough to use a small amount of electrode paste, but so that the electrode cup is completely filled. Glue the electrode and fix it using adhesive tape. The electrode cable must be positioned so that it does not bother the patient. Connect the ground electrode to the corresponding input of the polysomnograph. In the same way, after treating the necessary skin areas, we place the reference electrodes on the mastoids. Connect the electrode cable to the device connectors marked as M1 for the electrode on the left and M2 for the electrode on the right. We mark the points found according to the 10 to 20 system on the patient's skin with a special marker. Now we move on to positioning the EEG electrodes on the patient's scalp. For this, in addition to an alcohol wipe and electrode paste, we need small gauze pads. We prepare the point where we will place the electrode with an alcohol wipe. We apply a significant amount of electrode paste, slightly more than necessary, to glue the electrode. We can use this extra electrode paste for additional fixation of the electrode. After that, we take a gauze pad, apply a small amount of electronic paste to it, and stick it to the electrode. Moreover, we can apply electrode paste to a gauze pad. In this way, we have fixed the first electrode. We can also use collodion to attach the EEG electrodes to the scalp. However, it is crucial to remember that there are specific requirements for storing and using this substance. When positioning the EEG electrode, we use electrode paste to fill the electrode cup. After that, we treat the point we found with the alcohol wipe, glue the electrode, place a gauze pad on the electrode, use a brush to apply collodion to the pad, and dry the pad with a hairdryer. We position the electrodes at points F3 and F4. In the same way, we fix the electrodes at points C3, C4, O1, O2. Now we connect the cable for these electrodes to the recording device. To record the electroocculogram, we need two derivations. The active electrodes in these derivations will be located on the patient's face. We have already attached the reference electrode on the mastoid. We position the first electrode 1 cm below and 1 cm laterally to the outer corner of the left eye. We place the second electrode of the second derivation 1 cm above and 1 cm laterally to the outer corner of the right eye. We will use reusable cup electrodes to position the electrodes. In order to fix this electrode, we will need electrode paste. But in some cases, we can use disposable hydrogel electrodes with the button connector and the corresponding derivation cable to them. We fill the electrode cup with a small amount of electrode paste. We take an alcohol wipe and adhesive tape. We treat the skin area using an alcohol wipe, glue the electrode and fix it with adhesive tape. We place the second electrode in the same way. Then we connect the electrode derivation cables to the device. To analyze the stages and phases of sleep, we need one bipolar EMG derivation, which we position on the patient's chin. However, it is not always possible to reliably fix these electrodes, so it is recommended to put 3 EMG electrodes on the chin. We place the first central electrode 1 cm above the inferior edge of the mandible along the midline. Then, we attach 2 additional electrodes 2 cm below inferior edge of the mandible. One electrode should be placed 2 cm to the left and the other one 2 cm to the right of midline. To record an electromyogram from the chin, you can use reusable cup electrodes and electrode paste. However, in some cases, doctors use disposable electrodes with the button connector and the corresponding derivation cable to them. We degrease the skin under the electrode with an alcohol wipe, glue the electrode filled with electrode paste to the desired point, and additionally fix it with an adhesive tape. In the same way, we position two electrodes, which are located below the chin line. We connect the derivation cable of the EMG electrodes from the chin to the device. To diagnose cardiorespiratory disorders, it is necessary to record an electrocardiogram. According to the recommendations, during a polysomnographic study, it is necessary to record the single modified ECG lead 2 using torso electrode placement. We use a bipolar derivation. We fix the negative electrode below the right clavicle at the mid-clavicular line. The positive electrode is placed on the left lower chest at the anterior axillary line in the 6th or 7th intercostal space. We have already attached these electrodes. To record the electrocardiogram, we can use both disposable hydrogel electrodes with a button connector and reusable cup electrodes. We treat the electrode placement area with an alcohol wipe and glue the electrode. Now we can connect the ECG electrode derivation cable to the polysomnograph. To record the respiratory flow, according to the recommendations, we should position the airflow sensor based on the thermal resistor on the patient, as well as a nasal cannula, which we connect to the airflow pressure sensor. This sensor is already built into the device. Firstly, we carefully position the airflow sensor on the patient's face, after which we can apply a disposable cannula in the same way. To be sure that the cannula and sensor will be in the required position during the study, we additionally secure the sensor cables and the cannula with adhesive tape. Then we connect the airflow sensor to the corresponding connector. The cannula must be connected to the screw pneumatic connector on the device with a rotating motion. To register snoring, we will use a snoring sensor. It can be placed without any gel or paste. We will position the sensor on the patient's neck and ask the patient to imitate snoring or cough. Cough, please. In this case, we find the point of maximum vibration, degrease this area of the skin with an alcohol wipe and glue the snoring sensor with the side marked with a blue dot. Then we connect the sensor derivation cable to the device. To assess respiratory efforts, we can use respiratory effort sensors with belts or inductive or RIP belts with appropriate sensors. In this case, we will use inductive belts. Stand up, please. We fix the first belt at the level of the armpits. We have previously adjusted the length of the belt. This belt allows you to control the thorax movements. We place the second belt just below the patient's waistline to record the abdominal movements. We connect the sensor to the belt. Now we need to connect the inductive belts to the device. To connect the inductive belts to the Neuron Spectrum AM device, we need to use such an adapter. We connect the green cable of the adapter to the ground connector on the device and the ground electrode directly to the adapter. We connect the black cable from the upper belt to the adapter and the red one directly to the connector marked plus THO thorax. We connect the black cable from the adapter to the connector marked minus. The lower belt is connected in the same way, that is, we connect the black cable from the lower belt to the adapter. We connect the red one to the connector marked with a plus and the black cable from the adapter to the connector marked with a minus. Sit down, please. To register the saturation of hemoglobin in arterial blood with oxygen, it is recommended to use the pulse oximeter sensor. This can be either a disposable sensor or a reusable one. We position the sensor on the patient's hand. Preliminary, we treat the finger with an alcohol wipe. Then we put on the sensor. Bend your hand to a comfortable position and fix the wire with adhesive tape. The wire from the sensor must be passed through the patient's pajamas or t-shirt and connected to the device. If necessary, the wire from the sensor can be additionally secure in several more places with adhesive tape. To record limb movements during sleep, it is recommended to use two bipolar EMG derivations. In this case, we fix the electrodes on the patient's legs. To record an electromyogram, we can use either disposable electrodes with a button connector or reusable electrodes. The electrodes are placed in the middle of the anterior tibialis so that they are 2 to 3 centimeters apart. We treat the electrode fixation points with an alcohol wipe and glue electrodes. After which we connect the derivation cable. We can additionally secure the electrode derivation cables with adhesive tape. We position the electrodes on the right leg in the same way. We attach the cables to the electrodes and fix the electrode derivation cables with adhesive tape. We connect the cables coming from the electrodes on the left and the cables from the electrodes coming from the right to the device. Thus, we have attached all the sensors and electrodes that are necessary for conducting a polysomnographic study. When using the neuron spectrum AM polysomnograph, there is no need to additionally fix the body position sensor, since this sensor is already built into the device. Now you need to connect to the neuronspectrum.net software and check the quality of the electrode placement. To do this, you need to measure the impedance. If the impedance is within normal values, you need to lay the cables for all sensors and electrodes so that they do not disturb the patient. After that, you can start the polysomnographic study.